Hello. Today I'll be answering the question, how safe is your baby's food? My name is Sarah Pacheco, P4 pharmacy student at the University of Connecticut School of Pharmacy, working with Dr. C. Michael White, a distinguished professor and pharmacist from the UConn School of Pharmacy. A new congressional report warns that heavy metals, including lead, arsenic, and mercury, can be found in commercial baby food at levels well above what the federal government considers safe for children. A 2019 report found that out of 168 baby foods, 95% of them contained at least one heavy metal. Many of you may be asking, how can heavy metals get in one's baby food? To answer that question, heavy metals arise from the Earth's crust, and humans have greatly accelerated this process through the use of fossil fuels by expelling the heavy metals into the air. Lead was commonly found in gasoline, paint, pipes, and pottery glazes for decades. In fact, a pesticide with both lead and arsenic was widely used in crop production in orchards until it was banned in 1988. Although there are now processes to remove a proportion of heavy metals from drinking water, heavy metals accumulated in the soil over decades is still an ongoing problem. So how much lead is too much? The World Health Organization and Food and Drug Administration have defined tolerable daily intakes of heavy metals. However, it's important to recognize that for many heavy metals, including lead and arsenic, there is not a daily intake that is completely avoiding any long-term health risk. The FDA considers 3 micrograms per day or more to be a cause for concern in children for lead, well below the level for adults, which is 12.5 micrograms per day. Lead, for example, is a heavy metal that cannot be stored readily in the bones. With this being said, it'll float in the bloodstream and accumulate, which could potentially lead to neurological deficits. Children with such a small size can have more of an impact due to their reduced volume. The lead levels that we are discussing are about 1/10 the dose needed to achieve a blood concentration that could lead to these major neurological problems, including the development of behavioral issues like aggression and ADHD. That doesn't mean that the lower doses are safe. However, recent research does show that the lower doses still impact children and adults neurologically and dramatically. Here's an example that can put all this information into context. If an infant consumes a carrot baby food that contains 0.67 micrograms of lead per ounce on average, if this infant eats 4 ounces of vegetables a day, that would be 2.7 micrograms of lead a day, almost the maximally tolerated dose of lead before you get to the concentration that could potentially lead to the neurological deficits. A parent could first reduce their child's risk of heavy metal exposure by switching away from rice-based products. A study by the group Healthy Babies Bright Futures found that if parents switch the products of their food from rice-based products to other products such as oats, corn, barley, or quinoa, it could reduce arsenic exposure by 84% and total heavy metal exposure by 64%. Another example would be alternating between root vegetables and other vegetables. The roots of the plants are closest to the contaminated soil, and by reducing your root vegetable intake and alternating between non-root vegetables, you can reduce a child's exposure to heavy metals by about 73%. And lastly, of course, making your child's own baby food is a great way to reduce heavy metal exposure. However, a parent should still realize the ingredients they are putting into their baby's food to ensure it is not high in heavy metal content. The congressional report pointed out that the FDA needs a better way to properly define the limits for heavy metals within foods. The congressional report also suggests standardized testing for all baby foods within the industry. The testing of the raw ingredients would be beneficial for the parents of the children that are consuming such foods. It would allow them to make an informed decision based on the nutrition label on the heavy metals that their child is consuming. Baby food manufacturers are always discussing this issue. In fact, the Baby Food Council was founded in 2019 to bring together major infant and toddler groups, advocacy groups, and research groups with the goal of reducing heavy metal exposure within baby foods. They even created the Baby Food Standard and Certification Program to collaboratively test and certify the raw ingredients going into baby food. With the United States constantly reducing the amount of heavy metals exposed in our environment, there will one day be a solution to not only just reduce heavy metals within baby foods, but other foods as well. We hope you found this video informative and will refer to other videos in this series on the current state of dietary supplements. We do not know the specifics of your medical history, so these videos are not a suitable substitute for personalized medical advice. Thank you.